Okay, that's great. Well, good afternoon, everyone, and welcome to the weekly seminar series. Research, and today's seminar is jointly sponsored and is part of the York Climate Change Research Month. And I believe this is actually the kickoff seminar. So I'm very happy and excited about being part of the Research Month, which will highlight research at York that is seeking to move the agenda, the policy practice agenda forward around the impacts of global warming or climate change. My name is James Orbinski, and I'm the director of the Institute, the Dahdaleh Institute. And before we begin with my seminar, which is titled Modeling the Health Impacts of Climate Change in Malawi, I'd like to ask Hannah to do our land acknowledgement.
Okay.
Hannah, would you mind?
Thank you so much, James. So as this is a virtual event, all guests are on different territories. So please give the time to give thanks and respect to the land which you are currently living and working. And today I'm here on York University campus in Toronto, which is situated on the traditional territorial area known as Takaranto, and we acknowledge its current treaty holders, the Mississaugas of the Credit First Nations. We also acknowledge that this is the traditional territory of many Indigenous nations, including the Anishinaabe Nation and the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. This territory is subject to the Dish with One Spoon Wampum Belt Covenant and agreement to peacefully share and care for the Great Lakes region. And with that, I'm just going to turn it back to you, James.
Thank you so much, Hannah. And I'm in Costa Rica, actually, as we speak, and I've been here for the last few days as part of a York University course that's taught at the York University Eco Campus in Las Nubes, Costa Rica. And I've been teaching around eco-health methodologies. And it's been a real pleasure to be here. And I'm going to talk a little bit about some of those methodologies in relation to modeling the health impacts of climate change in Malawi. So just bear with me for a moment while I set up my slides here. And they are right here. There we go. I'm going to start my slideshow. Okay, can you see my slides? Can you see my slides?
Yeah.
Hello?
Yes, we can.
Okay, thank you. So I'm going to talk for the next few minutes about two things. One is the project that I and many others have been deeply engaged on in Malawi and that we are looking to further develop. And the project is on modeling the health impacts of climate change in a particular region of the country called the Chilwa Basin. And I'm going to do that, and our partners for that project are the government of Malawi and many, many different ministries, the Dahdaleh Institute, of course, the University of California, Irvine, and a series of researchers there, and LEAD South Africa, or for the southern region of Africa. And the project, as it now stands, is funded by the Wellcome Trust. The aim of the project has been and will be in a much more focused way, focused on designing and testing community-based simulation tools that can assist community, government, and NGOs to adapt effectively to the health impacts of climate change, and all with a view to actually reducing those health impacts. I want to also talk a little bit about the global context within which we're doing this. I had the privilege of attending the COP27 talks in Egypt this past fall, as did a number of others from York. And I think it's quite important to recognize that the COP process and the COP27 talks were very much a massive, if not egregious, failure. And the global issues that are at play, that are significant forces in defining the effectiveness of the COP process, really overshadowed what was possible to achieve in Egypt. There were three areas of focus, and one was on climate finance and delivery of a fund that was promised back in 2009 at a rate of $100 billion a year, that has only partially been delivered, and which, even when delivered, only about 8% of funds that have been made available, only about 8% of those funds actually get to the countries that need those funds for project implementation. That's a major, major problem. The other goal of the COP process, and particularly of the COP27 process, was to accelerate global decarbonization. And not only did that stagnate, but in fact, a provision was slipped in at the end of the process that allows for, in fact, even greater carbon emissions. The one thing that was touted as a success was the creation of what's called a loss and damage fund for the losses and ongoing damages that have already accrued and that will accrue largely in the global south. Now, this was really just a nominal moment of recognition. There was no detail about who would fund, when additional funds would be made available, if these funds would in fact be additional to the $100 billion that has been promised back in 2009, and so on and so on. There are many details that I could go into, but I think my overall impression was that this multilateral process is not moving in a significant direction, a significantly positive direction to sufficiently address the reality of the global warming crisis. I just want to kind of point out that some of the real circumstances that people live in today. This is Somalia today. There are literally millions of people who are starving and who are on the verge of a massive famine. And this is Somalia actually 30 years ago, where famine and civil war also occurred, and where 400,000 people died back in 92, 93. There was since, between 92, 93 and today, in 2011, there was another major famine. And each of these famines, when one looks at the meteorologic data, each of these famines are very much accelerated. They're not exclusively caused by climate change, but they are massively accelerated by extreme weather events, and most notably drought, that is directly attributable to climate change. So food, and now more broadly, food insecurity globally is very, very much a major, major issue. So today, about 800 million people, if not more, are directly affected and are food insecure to the extent that they are not able to garner in sufficient calories or sufficient food intake to meet their very basic needs. Famine-like conditions exist today in 43 different countries. And these conditions are either directly caused by climate change or accelerated and exacerbated by climate change or global warming, or global boiling, in fact, as I like to call it. And I'd just like to point out, without going into any real significant detail, I will point out that that carbon emissions, while there is variability in carbon emissions, as this graph shows, over the last 400,000 years, and that's the only period that this graph captures, while there is, you can see a variability there. You can see an upward and a downward and upward and downward sinusoidal graph. That's normal climate variance. That's normal carbon variance. And one sees with that normal variances or variances within climatic conditions. But what we see at the end of the graph, roughly around 1950, is a massive increase in carbon emissions. And what we see today, and you can just see where I've pointed it out, in 2022, we are at 417 parts per million of carbon dioxide emissions. And this is well above the 300 parts per million threshold that sustains a normal variability across climate. And so because of that massive increase in carbon, which is, by the way, continuing to increase every year, despite the Paris Agreement, the consequence of that is massive change in climatic conditions, leading to extreme weather events, leading to change in temperature, leading to changes in ecosystems, and so on and so on. So this is a very real phenomenon. And this graph here just simply shows carbon emissions relative to the various agreements that have been put into place since 1990. And what you can see is that despite these agreements, there is still a massive and highly significant increase in carbon emissions. And it will, even to bend the curve, it will take enormous political will and enormous effort in terms of social structure and functionality to bring down the rate of carbon emissions. All of that said, we're also living in a time where we're seeing massive increases in the number of people who require humanitarian assistance. And probably the biggest driver, the biggest recognized driver of this now today is, in fact, climate change. We're at 300 million people who need humanitarian assistance. And of those, only 200 million are actually targeted with direct humanitarian assistance by UN agencies. And we also see that there's a massive gap between the required funding for provision of humanitarian assistance versus what's actually given. So last year, UN agencies asked for about $46 billion globally to provide humanitarian assistance, not to 300 million, but to 200 million people, despite the fact that there are 300 million people who need humanitarian assistance. And even of that, only 18% was actually covered by donor governments. So we have a very significant and serious situation where there's massive, enormous, overwhelming, and growing need that is being accelerated and driven by the health impacts of climate change, or by climate change. And some of those impacts obviously are health. So I just also like to point out that we live in a world of complex systems. The world is, the dynamics between multiple systems or ecological systems, these are changing because of climate change and because of, more directly, because of temperature change and global warming. And some of these are we can capture, we can understand, given our current science and our current modeling techniques. But most of this we actually can't or do not yet fully understand. And so the implications are really quite serious. And all of this takes place against a backdrop of not so much a backdrop, I should say, but all of this takes place in this kind of paradox where life expectancy for human beings since 1950, globally speaking. There certainly are regional differences and the regional variances, But globally speaking, since around 1950, life expectancy for human beings has increased very, very substantially. Also, again, globally speaking, poverty has reduced very, very substantively, globally speaking, since 1950. And the same is true for child mortality. So there have been very significant health increases or health improvements since roughly 1950. But this has come at a cost, and the cost is really ecological. We see massive increases in carbon dioxide, massive increases in ocean acidification, massive increases in energy use, in tropical rainforest loss, in water use, and in the use of fertilizers. Now, the interaction of these consequences with the so-called improvements of human health are now revealing themselves to be themselves a serious threat, not only to human beings, but to the biosphere as a whole. Also, there are other major changes that are really driving accelerated climate change, and that must also be considered in any kind of systematic approach to intervening to improve adaptation or to intervening to reduce greenhouse gas emissions. So we are witnessing a massive urbanization of human population. And right now, today, November 22nd, actually, of last year, we passed the 8 billion point. We are 8 billion people on the planet. And of those 8 billion, 56% live in cities. And those cities are not the shiny, gleamy towers of downtown Toronto. About 50 to 75% of those people who live in cities live in settlements like this. These are the slums, squatter settlements, barrios of most major cities in the world. And the rate of urbanization is increasing at such a point so that by the year 2050, 2 out of every 3 people on the planet will live in a urban environment. And of those, between 50 and 75% will likely live in circumstances like this. So at the same time, and I've talked about humanitarian need, 58% today of refugees live not in refugee camps, but in cities. And that number is expected to grow because of the drivers of displacement and movement of people across borders. And one of the major drivers, of course, is climate change. The other big context issue to understand is that we live now in the age of the Anthropocene. And this is not the domain of obtuse or rarefied academics. This is very much a recognized reality by major public thought leaders and institutions and scientific institutions. And the Anthropocene is the period of geological, environmental, and biological transformation of the planet by human beings, by human activity. And this is so profound that the impacts of human activity are actually now causing the 6th great extinction from a planetary perspective. The last great extinction occurred 65 million years ago with the elimination of dinosaurs. And we are now in what is now the 6th great extinction, and that is driven not by meteorites or things landing from space. It's driven by our activity. And that activity has also major human implications in the broadest sense. While I described earlier, that there have been massive improvements, what's also true is that inequality is rising around the world at different rates and different speeds in different regions. And that difference, that variability of the rise in inequality indicates that institutions and the policies of institutions and of governments, these actually matter. They actually make a difference in terms of the kind of inequality, the rate of increase or the rate of decrease in inequality. And that's really the kind of point that this slide is trying to make. And I won't go into more detail at this point, but and so the last kind of context factor that I want to touch on is the UN Sustainable Development Goals. These very much recognize that 2022, 2023 is a time of multiple and converging crises. And that these are not, climate change is one of them. The risk of pandemic disease, the risk of failures in global governance, most especially in relation to war. And the war, of course, that is on everyone's minds is the Ukraine, because it brings, there's a kind of a converging of great powers that are sparking as they move. And that is driving changes and failures in many cases in global governance, and most especially in the case of global warming. That is really driving by virtue of diversion of attention and by virtue of changes in the dynamics of global supply chains. That is driving our response, our very necessary response to climate change. And that response is, in fact, by virtue of evidence of COP27, at this point, a very significant failure. Now, but the Sustainable Development Goals really seek to move us through a period of transformation globally. And it's really a transformation that is based on practical problem solving, or what we at the Institute call critical problem solving, for greater effectiveness, equity, and excellence in global health. And that's very much the orientation of the Dahdaleh Institute, and it's very much oriented in that direction with a view to supporting the Sustainable Development Goals. And this is the SDGs also are inspired, if you will, by a vision of wellness, not by disease, not by coping with adversity, but with doing so in a manner that actually contributes to and grows human wellness. And that too is a major focus of the Institute. And I'll just take a moment to highlight that we focus on critical problem solving for greater effectiveness, equity, and excellence in global health. And we have three themes: planetary health, global health and humanitarianism, and global health foresighting. As I've just described, effectiveness, equity, and excellence are the driving values, if you will, of the Institute. And our approach, we're very transdisciplinary in our approach. We're experimental and experiential, and we very much emphasize participatory methods. Within that context, planetary health being one of the themes, we really emphasize that we are part of nature. The idea that we're above nature, that we have a dominion over it, that it's endlessly abundant, this is a dangerous relic of an age that is an age of arrogance, frankly, and ignorance. We are not alone, and we are not independent of the natural ecosystems that we need in order to live. We're part of nature. We depend on ecological systems to sustain us. It's a dependent relationship. It is not an interdependent relationship, and it is not a symbiotic relationship. We depend on the health of the biosphere. And that really is the essence of the causality, if you will, in terms of the concept of planetary health, that the health of human civilization and the natural systems on which those civilizations depend, that's the relationship that planetary health seeks to explore and seeks to pursue wellness within. And so it's very much about the relationship between civilization and natural systems, but the one of dependence is really the critical point that I want to make here. It's very much a way of being in the story of our relations to each other and our biosphere. We need to really shift how we think and how we behave in relationship to each other and in relationship to our biosphere. And that's the essence, if you will, of the concept of planetary health. And within that, from a research perspective, what that means is that an ecosystems approach to health is actually a highly, highly effective approach that can yield very, very significant results. Now, the ecosystems health approach has 6 core principles to it. And I won't go through these in any detail. I'm just going to simply give them to you. I think that for the people that are assembled here for this seminar, these are self-evident, but it's important to highlight them as a package. And the 6 principles are systems thinking, knowledge to action as an orientation, transdisciplinarity, participation or use of participatory methods, a commitment in practical terms to equity, and a commitment to sustainability. So those are really the core concepts of an ecosystems approach. And this is what we're trying to apply in Malawi as we approach modeling the health impacts of climate change in the Chilwa Basin. There, we're taking an approach that really focuses on community, that uses, that it seeks to engage and use research in with a view to affecting policy. Now, these are not independent things. These are related to each other. Research, we engage community through our research and our research methodology, which is a participatory method. The relationship between research and policy, it's not that research delivers the 11th commandment or the new insight and then gives it to policy to implement. There's very much a relationship between policy and research. And policy, as we know, is not simply a matter of evidence. Evidence is absolutely necessary, but it's part of a process. And that process is highly political. It's also dependent on multiple variables. And it's also, most importantly, dependent on the concept of feasibility. So if you're engaging in research, which we are, that's community-based and that is participatory in nature and is geared towards helping to shape policy, it means that one must be engaged at the outset, not only with community, but also with policymakers. And that policymakers must also be engaged at the outset and in an ongoing way with community. This triad of relationship between community research and policy, the idea is that this changes practice, and practice is not perfection. Practice is an effort to improve and to get better at whatever goal one is seeking to achieve. So this is very much our orientation. And we are using agent-based and systems dynamics modeling to understand the health impacts of climate change in the Chilwa Basin. Now, just to give you a very quick flavor, when we talk about community, we're talking about human beings, obviously. We're also talking about how human beings in a particular place and in a particular time organize themselves to achieve the things that they wish to achieve. And so that means understanding the reality of a particular community, understanding the reality of the human beings in that community, the gender dynamics, the differences in health status between different age groups, the drivers of those differences in health status, understanding their housing, their way of life, fishing, their way of supplying energy for their cooking and heating needs. So in the Chilwa Basin, that's very much about wood and charcoal making, which leads to deforestation, which leads to soil erosion, which leads to eutrophication of the Lake Chilwa, which leads to changes in the pattern of waterborne infectious diseases. It also means understanding farming, their specific agricultural practices, and in a marsh territory, which is the territory of the Chilwa Basin, the interaction of farming practices with marsh land and also with organisms and pathogens that are changing as a consequence of human activity and as a consequence of global warming and of ecological degradation. It also means understanding the animal husbandry practices, understanding people's people's form of worship and the things that they hold sacred, and understanding also very practical issues like access to water, the quality of that water, access to healthcare, the quality of that healthcare, and their access to engagement in policy process. There's many, many more things that I could put up here on this slide, but this just gives you a flavor of the approach that one must take if one is thinking about systems dynamics and systems dynamics modeling, and also about agent-based modeling when trying to derive from that systems analysis very specific interventions. So what we've done is we've taken, looked very deeply at the Chilwa Basin, and we've created essentially a model that has identified 6 key subsystems as they relate to health, to very specific health outcomes. So the subsystems are ecological services, extreme weather events, food security, infectious diseases, disaster risk management, and clinical public health interventions and strategies. And each one of these is mapped, and you can see schematically, each one of these subsystems is mapped according to one of the color-coded entities that's at the center of the slide. And within each system, there are variables that relate to each other in different ways at different times. And what we've done is we've used community mapping, causal loop diagrams, policy process mapping to create an understanding of each of these subsystems, and also of how each subsystem relates to other subsystems, all with a view to understanding the causes and conditions and drivers of health or disease in 4 very specific disease categories. And it's schistosomiasis. We're focused on schistosomiasis, cholera, malaria, and malnutrition. And what we're hoping to do is with these subsystems now properly mapped, we're hoping to define 3 intervention pathways. One is treatment. So if you can treat a disease, you should treat it. The second is prevention. If you can prevent a disease, you should prevent it. And the third is if you can adapt the structures and the functionalities of your society in relation to a changing climate, then you should do so, and you should do so with a view to improving health outcomes in the 4 targeted diseases that we have we've focused on. So this is what we're trying to do, and we've developed. We've chosen systems dynamics and agent-based modeling as the best way to achieve the understanding that we're looking for. I'm not going to go through this, but what I'm just going to, all this is trying to show you is that there are different ways of thinking about modeling. One can look at static systems, or one can look at dynamic systems. And ours obviously is a dynamic system, and within dynamic systems, you can look for the effect of a discrete event, which you see on the far right, or you can look for the effect of subsystem interaction, which we can capture through systems dynamics modeling and also agent-based modeling, and that's what we have been doing. We've developed a series of applications around, for example, the impact of flood events in the Chilwa Basin. And we've modeled this using satellite data, using data from health systems, using data from multiple sources within the Chilwa Basin, and from government and NGOs and others. And we've taken each of many variables, which are depicted here as different icons, and these are some of the variables the issues that I described earlier. For example, energy use and charcoal and deforestation. These are depicted within these variables that you now see in front of you, and what we've done is we've mapped the relationship and we've quantified those relationships across variables to create graphic representations of those relationships, which you can see just by example, depicted down below with the red spirally graph. And we are able to overlay using different data system and different data modeling techniques. We're able to overlay different relationships between different data sets or subsystems, and then look for correlations and relationships between those to map the complexity of the subsystems that are of interest to us. And we've been working on this now for about 3 years through COVID, which presented its own challenges, but we're moving very nicely forward. And we've several workshops in Malawi and either virtual or hybrid, virtual in person over the COVID pandemic, or in person as we did this past August. And we're moving very, very nicely forward in this direction. And what we're hoping to do is now to use the modeling systems and the community-based participatory methods that we hold with great value. We are hoping to use community-based health and environmental data for 3 objectives. This is the future now: for better adaptation, for early warning around the impact around either extreme weather events or around the impacts of extreme weather events, and also thirdly, for disaster risk reduction. And we're hoping to improve response capacity, not simply of government, but more importantly of community, to adapt, to have a better understanding of early warning, and to engage more meaningful disaster risk reduction strategies. So that's what we're trying to do. And we're doing it again through an ecosystems approach to planetary health. And again, the 6 principles that we're trying to apply, and that we hope, apply with even more rigor in the absence of the COVID pandemic over the coming years. So that's very much what we're doing. And we're doing that with a view to recognizing that while the broader geopolitical process around COP and climate change adaptation strategies and climate change mitigation strategies and greenhouse gas reduction strategies, while that moves along, the reality is that there are literally millions of people, whether in Somalia, whether they're in Malawi or in Costa Rica or in other parts of the world, there are literally millions, if not billions of people who are already directly experiencing the impacts of climate change. And it's extremely important and that we develop tools, policies, and practices that can help people actually functionally and practically adapt to the reality of climate change. And most, in our instance, or in our case, most especially around the health impacts of climate change. So that gives you an idea of what we're doing. And we're very much taking a life-centered design approach. We're very much aware that human life exists within a sustaining ecology. And that ecology is not just for human life, but it's for all life, which includes human life. And that nature-based solutions are a really, really important approach to improving better adaptation. And also, I and many others believe that nature-based solutions will also have a very, very significant impact, not just on adaptation, but also on mitigation for the human civilizational causes of climate change, and also the human civilizational impacts of climate change. On this particular project, here's a nice list of all of the people that are involved. One here at York, there's myself, Ali Asghari, Martin Bunch, all of the fellows that are listed, with the exception of Joe Schubert, who's at University of California, James Chirombo, who is in Malawi. And then our graduate students are Eunice Choi and Nell Ganguly. And then Ann Lee is a graduate student at UCI in California, University of California, Irvine. And there are others, but these are the key people. So that gives you a sense. Again, we take very much a critical problem-solving approach to dealing with the health impacts of climate change. And our goal is to produce something that's effective, that is committed through practice to equity, and that uses a commitment to excellence to achieve the best possible outcomes in global health. So let me stop there and invite people to comment or ask questions, and see how people react over this. Just raise your hand if you'd like to ask a question or offer a comment, and I'd be very happy to try to react. Let me get the gallery view. Oh, there's the gallery. Okay. Have I left you all speechless? I can't believe that.
I raised my hand, James. It's Sanjay.
Oh, hi, Sanjay. How are you?
Very well. Thank you for that extraordinary presentation of a lot of painstaking work that you've been doing, both conceptually and in terms of frameworks, but also application, and then doing the hard work to develop some mapping and understandings that help, I guess, elucidate a path forward towards health and improving health in very difficult circumstances. I just wanted to briefly say that some of the work you're doing is very interesting to a group of people I'm working with. We've been commissioned by the Canadian Agri-Food Policy Institute, a team of 4 of us, including former leaders of the US climate enterprise, to look at agri-food system supply chain vulnerabilities in Canada. And that project has been funded by Agriculture and Agri-Risk Canada, and we're doing vulnerability mapping. Our task has been to look at the confluence of geopolitics, pandemic, and climate change. And so I see some echoes in your work that's much farther along. We're really at the point in our work, our initial deliverable is just to start to frame this for agri-food system actors in Canada, but the global nature of inputs, you mentioned the Russia-Ukraine war, you mentioned the implications of that for rising food insecurity globally, but I think there's some of us on the panel that would love to have an opportunity to interview you and maybe some of the other researchers to see where some parallels might exist sort of further down the road in our work. So thank you. That was really a stunning presentation.
Well, thanks, Sanjay. For those who aren't familiar with Sanjay, Sanjay is one of Canada's leading foresight strategists, and works with government, with business, and with UN agencies and NGOs on foresighting strategies, ways of understanding, or at least grasping the realms of possibility for the future in both positive and negative configurations, and how best to strategically shape your organization's engagement with that foresight, with that imputed future. And I'll just say, I'd give everyone, if anyone has an opportunity to interact with Sanjay, you should grab it. Very, very smart guy, and kind of knows what he's talking about. So Sanjay, I would like to follow up with you on that and see if, where, and how there's some point of discussion or collaboration. And you will see, and as you know, just from our own relationship, our own friendship, and also from this work, you can see we're very pragmatically oriented, in the sense that, yes, there are global issues. We have to understand those as drivers, And we have to be able to position response relative to that fluidity. But one must be able to actually do practical, concrete things that actually help individuals and communities make good choices and get better health outcomes. And so that's really what we're trying to do. And there's many challenges to that. I mean, obviously the geopolitics are really important, but there's also very practical challenges, you know, like getting data, being able to integrate data from different ministries within the same government, being able to integrate data from different regional sources of data, being able to integrate data sets and have one be able to talk to the other from for example, from satellite derived data to all the way down to, you know, to the borehole, and being able to create the right data interfaces so you can do the right analyses. And then the other big challenge is, and it's actually the most important challenge, is how do you value data? What is the meaning of the data? And before you look for interactions across data, what is the value of the data? And that really depends on who's looking. And if you take a community-based approach, as opposed to a government or a corporate or a UN agency or whatever, there's a very different valuation of a particular variable. And so what we're trying to do is really create a community-based valuation of data and of different data sets, so that when we model the outcomes or the projections, the simulations are actually useful, you know, to the farmer, to the women's group, to the water, sanitation, and hygiene group in a particular community, as opposed to useful to you know, to UNDP, you know, for understanding you know, the global drivers of development and the impacts of for example, climate change. So just to kind of give that to you, that's very much our orientation. And it would be great to have a conversation on that basis. So thanks for your comment, Sanjay. Jim, did you want to ask a comment or give a comment? Go ahead, Jim.
Yeah, thank you, James. Thank you for really great, amazing presentation. Very clear, and yeah, you guys are doing great work. Just wanted to compliment you on that. Also super jealous that you're in Costa Rica at the moment. I think I have more of a comment, but possibly a question as well. One of the things I was reflecting on through your presentation was the framing of planetary health in general. At the early part of your presentation, you were presenting some of the ways that planetary health has been framed, primarily through the work that was done in the Lancet report. And you mentioned, for example, the sort of paradox in the fact that, you know, there are so many places in the world sort of on the edge of famine, but when you look at global stats, you see that global health, you know, is better on average than it's ever been. And at the same time, you know, the framing of planetary health makes it clear that those global stats around health improvement have been achieved through mortgaging the global environment. So, I mean, one of the things I was thinking about that, and particularly in relation to your presentation, was, you know, one of the critiques of the Anthropocene concept is that it universalizes, you know, human impact on the environment. And you see that in those global stats. Those global stats present this picture of global health improving at the same time as the global environment being degraded sort of universally. And I think, you know, I think one of the things that your work really highlights is the need to really think critically about that and to recognize that while global health has been improving, particular people's health has also been mortgaged in order to achieve those global benefits. and specific environments are also being specifically kind of mortgaged and degraded as well. So it's just something that, I was really reflecting on quite a bit through your presentation, is that really need to focus on that issue of inequality, both in terms of how human health is being mortgaged in particular environments, and also thinking about how that issue of inequality, and this is kind of a question that I was thinking of throwing out to you, is that issue of inequality is whether that's really one of the reasons why addressing issues like climate change at the COP level is really difficult, and why it has kind of failed in a lot of cases, because there are a lot of entrenched interests, and specific groups of people and companies and so forth are benefiting disproportionately from degrading the environment and accumulating vast amounts of wealth, and they have an interest in maintaining the status quo. And that also, for me, it highlights the importance of doing the type of work that you guys are doing as well on the ground with particular groups of people in particular environments that are being disproportionately affected. So yeah, thank you for your presentation, and love to hear your thoughts.
Yeah, so Jim, those are like, you just kind of nailed the core elements of the challenges. And I would just say that there are multiple dilemmas, right? And you've described in different words the dilemmas that I painted. And now a dilemma by definition is a situation where there's an imperfect choice. There's no right answer, right? And at the same time, one must make choices. And so I think what I've tried to articulate is that there is this global process that is taking place, and very clearly, it's not working in terms of coming up with meaningful global policies and practices that actually will reduce greenhouse gas emissions substantively in the period of time that we need it to be done, so that the human impacts are minimized, right, and also the ecological impacts. And that's why we one of the big reasons that we're just so practically focused, or trying to be so practically focused. But I will say that the dilemmas are very useful because they illuminate the fallacy of the paradigm within which one is operating. It helps you see that the way you hold a problem either is functionally effective or functionally ineffective. And the way we hold the problem now, in my view, the way we hold the problem of global warming is profoundly ineffective for all of the reasons that you've just described, and also I described them in slightly different terms, but it's deeply ineffective. What we need, in my view, and I sort of said it, in nice words. What we need is a new story. We need a new way of seeing each other as human beings, and also a new way of seeing our relationship to our biosphere and to Mother Earth, right? As our indigenous friends and colleagues would call it, and that we need to see this in a way that is not extractive, is not power over, it's not dominion of. It's life in, right? And this is a huge, it is the existential challenge of our time, and the finding that story, creating that story, and that is not that's not a declarative process, right? That is a dialogic process, and it's a process that is gradually emerging. It's across communities, it's across cultures, it's across nations, and it's across time. And that, I think, is really the biggest sort of reality, is that we often as human beings, most often we think in terms of myself, my own life, that I am and I will be forever. Well, it takes great wisdom to recognize that we are part of something bigger than ourselves, right? And that there are many generations, not just of human beings, but of life processes, and that these have different time scales, and that those scales are beyond what most individual human beings can imagine. But the necessity of at least having within one's culture or one's civilization, the necessity of having and holding wisdom, and having that wisdom present and being operative in shaping choices for people, for most of us, who are only capable of very short-minded, limited term thinking. Even that's how we are, you know. But wisdom is a necessary, absolutely necessary framing of any civilizational and therein individual choice. Now, that's a very hard thing to talk about today, most especially in Western civilization. We've gone through this incredible process over the last 700 years, 800 years, and these are very difficult issues to find words for and to find valence. They're not valued, right? So, you know, this is the struggle and the dilemmas that you've pointed out, that I've pointed out. Those dilemmas, they're real gifts in a sense, because they show us again how wrong our framing is, that we are holding this problem in the wrong way, right? And so that, you know, for anthropologists like yourself, and for storytellers, and for, you know, our informal leaders and our elders and so on, these are the, you know, these challenges matter, and it is people like you, Jim, really, frankly, you know, with this sensitivity to culture, and to how cultures are and how they change. These are your challenges, you know, very much, you know. So that, anyway, that's my reaction, and I know that we could have a much deeper conversation, but I did want to just acknowledge very much two people who are in the group here. One is Nell, and the other is Muhammad Ali, and not the boxer, but the modeler. So Nell Ganguly and Muhammad Ali are part of this research team, and they both, and Eunice. Is Eunice with us? Where's Eunice? All three have made enormous contributions conceptually and practically to this project. It is such a privilege for me as a professor to work with people who really are committed to not just nice ideas, but to actually moving forward. And each of those people, Eunice, Muhammad Ali, and Nell, are, like, for me, they're perfect examples of what, you know, what a student professor kind of relationship can achieve. It has been, and I hope will be over the coming years, if we're able to be successful in our funding applications. It has been such a pleasure to work with you, Mohammed, and also with Nell and Eunice. And you have made enormous contributions to this project, and it's deeply, deeply appreciated. Yeah. Any further comments, thoughts, reflections in our last minute or two or three? Imran, you're smiling. That means you're thinking, so go ahead.
Well, thank you, James. I didn't want to ask the question because I don't know how much time we have left, and maybe we can
go ahead. Yeah, please. Yeah.
About this. But it's fantastic to see the progress that this project has made over the past couple of years, and the scale and the ambition of the modeling challenge here. I wanted to just get a bit more insight on the kinds of challenges encountered with getting the right kinds of data and then using that for modeling purposes, and how successful you've been in that process of going from upstream ecological, environmental, socioeconomic, demographic data to the health outcomes, say for cholera, schist, or something else. What has that process been like, and what is it, to what level of accuracy or resolution are you getting in those health outcomes?
Well, I will ask Mohammed to say something, if you don't mind, Mohammed, about some of the data challenges, and Nell as well. But I will say that it's been very painful dealing with this issue. And one of the people I met at COP was the chief scientist for the Red Cross, and we had a nice long conversation and about challenges, and we both agreed that probably the single most important challenge is the lack of standardization of basic health system data, and also not just standardization, but also availability. Like in Malawi, for example, there are there's kind of three classes of data. One is data that's written on pieces of paper in the health center that is not digitized. Then there is digital data, which is largely, frankly, projection based on aliquot sampling. So, they're not, like, even the National Household Survey is not of every single person, right? It's aliquots, and it's sampling of different communities. And then one does a whole series of regression analyses, and then national projections based on those analyses. So even the digital data that is relatively easy to access, it's not actual real data, right? It's derived data, it's projection, right? So that's very important. And then the third class is dirty data. So it's not, you have to clean the data, right? You have to remove biases. You have to remove massive outliers that suggest very strongly that the data was not collected properly, or whatever, right? So data cleaning, dirty data, and the ability to clean it is really, really a key challenge. And those three classes of data make up very much a kind of a Swiss cheese, of health data. There's massive holes in the data, and even the kind of the forms around the holes. A lot of that is not actually based on real data. It's either dirty or it's projection, right? So this is a huge, huge challenge. Now, at the meteorologic level, over the last 15 years, especially, the accuracy of meteorologic data collection has been exponential in its growth, right? But so there's all this very good, like even meteorologic projections, like they're so good now, Now there's differences, like in Africa, across much of Africa, there's not enough meteorologic, like specific meteorologic collection sites. So a lot of like projections for Africa or Asia, though they're projections and they're based on global modeling systems. But even that's better over the last 15 years. And the quality of that data is just amazing. And the accuracy of prediction is fantastic. Adapt. You gotta know what the baseline is in terms of actual health systems. And that applies to agriculture. It applies to disaster risk reduction. It applies to so many other things. So that's a real, real challenge. And I would say as well that same challenge exists for pandemic preparedness. It's exactly the same problem. You can't do good pandemic preparedness. You can't understand the emergence of a particular phenomenon or a potential outbreak if you don't have good data, good baseline data. Like it's not, we're not talking about, very sophisticated analyses. We're talking about basic health system data. And that is simply, that is a massive priority for so many different policy domains. And maybe, Mohammed, you want to say something about just the challenges that we've had, or Nell, if you'd like to.
Hi, everyone. First, I should say that it's very much my pleasure to be a part of your team in this project, and I learned a lot from you and other teammates. You covered whatever I wanted to mention, and the challenges are available, but common methods such as machine learning, statistical analysis, etc., we are using to link parameters one by one, and then look at the other factors that are affecting for a case like malaria, to see if the linkage that we found from the one by one comparing is good or not, and then decide for the relationship is and the equation that we need for our simulation.
Yeah, yeah, I won't add anything. Thank you, Mohammed. Nell, you're welcome to say something if you wish.
Very quickly, I'd like to actually echo Mohammed that the pleasure is all ours working with you and the rest of the team. But I mean, you've covered the challenges that we've faced, but I'd like to add that the positive, the silver lining of all this is that we have identified gaps and ways to actually contribute in Malawi. And the challenges have also allowed us to be very innovative, and I think we wouldn't have grown as a team if these challenges did not exist. I'll just stop there. Thanks.
Yeah, and that's a great, that's actually a really good way to end. You know, we don't live in a perfect world. We don't live in nirvana. You know, we live here, and it's beautiful and it's terrible and it's imperfect. And here we are. And the only way to kind of make things better is to figure out what works and what doesn't work, and where are the gaps. And actually learning where are the gaps is a huge, huge positive research outcome, so that we can then design around that, and with that we can create alternatives. We can innovate. We can try different approaches, and that's like, if I gave you a sort of a time sequence of what we've done over the last 3 years, it's like total adaptation, shifting, moving, refocusing, and then going back and revisiting and going forward, and you know, and we've made some real substantial progress, and that's what we're here to do, you know, is to make things better. And you only make things better when you know what's not better and where the gaps are. So Nell, that's a great comment, and thanks for making it. And Elaine, I'll give the last word to you and then we'll close. Go ahead, Elaine.
Yeah, so my question was that you talked a lot about a community-driven knowledge, and on the other hand, the data which you presented, which I know were an academic audience, so that makes sense, but the data that you presented was all statistical, and so most people don't have statistical training. So if you want to share knowledge in a way that can be meaningfully taken up by community, so that they can take all this data that you've gathered in these nice, you know, dotted spirals and all this kind of stuff, and actually use it to make the kind of political and community decisions they want to make. I just wondered how you're doing that piece of the knowledge translation.
Yeah, so it's a great question. The first of all, Nell will be doing a presentation at some point in the next little while on some of her ideas and some of her work, and it very much is an example of the application of participatory methods to understanding the gender dimensions of the health impacts of climate change. Now, I didn't go into it because I know Nell will do a far better job at it than I will. So that's one. I just want to emphasize that. And then the other is that the next big challenge here for us is to actually create the appropriate interface. So how you communicate this to people? How do you create, a web-based platform that people can use and that people do use on their phone, on their laptop, and that is specific to the user. So the interface that you create, for us as academics, and for a very specific group, and those ones that I've drawn from for agent-based modelers and so on, is a very different thing than what we would present using exactly the same data and the little spirally graphs and all of that. We would create a very different thing for a minister of health, right? Like his or her approach to decision making and to understanding is very specific, and we would baffle them into obscurity if I sat in their office and presented this to them. They would just like, oh well, I have no idea what you're talking about, and I've got another 5 minutes, so please make your point. So the way you approach the interface really matters, and we're very aware of that. And then the same is true by extension to an interface that you create for example, a women's group that we interact with, in fact, in the Chilwa Basin, who they dry fish, and they dry that fish and they sell it, and that's their primary source of income. So how you interact with them and the interface that you create for that particular group is very different than what we would create for the Minister of Health, for example. But it's all based on the same modeling. It's all based on the same data, and it's all based on the same analytic techniques. And when I talked, Elena, earlier about the valuation of data, really what I was getting at was, a women's group or a group of imams in the community will value a particular piece of land very differently than, for example, a flood management planner, right? And so if you value the data that comes from that women's group or from the group of religious leaders in the community, then you have to give that data greater valence, greater weight in the actual model, right? So that's the kind of issue that I was alluding to, and those valuations are reflected in the interfaces that you create for your different users. And so that very much is a big challenge for us now. And if we are successful in our next round of funding, knowledge translation, creating the appropriate interface, and so on, interfaces, I should say. This is very much the focus, or will be very much the focus of our future work. So, okay, and with that, I will close the seminar and thank all of you for being here and for listening so carefully, and for some really great and insightful questions that put me on the hot seat. So thank you. I appreciate that. And Sanjay, so wonderful to see you. And please do reach out with a quick note, and then we'll set up a time to get together.
Wonderful.
And with that, I'll let everyone go, and we'll see you next week at the same time in the same place. Thank you.